Hi and welcome. You are watching The Island Docs. I am Dr. Sandy and this is my co-host Dr. Gordon, and we're here to talk all things health
And health related.
and health related. Today our topic lined up for you is MIs, what we better know as heart attacks. It is so crucial to know about a heart attack because it can take a family member away from you in a matter of seconds. It's important that we pay attention to the signs, the symptoms, the risk factors because heart attacks are life changing and devastating.
What is a heart attack? What exactly is a MI? This is an irreversible, irreparable damage to the heart muscle secondary to ischemia.
What does that mean?
What that simply means is that your heart muscle is dying because it has been damaged because of decreased blood flow to the muscle.
Exactly. And blood flow comes from the capillaries going to the heart and the arteries. And what is happening is that it's bringing oxygen to your muscles when it's pumping. And you think about your heart, it's working all day, every day. It needs that oxygen. When you have a blockage because of plaque, because of some kind of thrombus, because of an emboli, that blood vessel can't get oxygen to that muscle that needs to work. So essentially what's happening, what we doctors call ischemia, is the death of that particular muscle.
Right, so you have a heart attack and it's dying muscle, but how does it present? There are a couple of ways that it presents, and some people are affected differently. Some people come in complaining of fatigue. Fatigue is just a general feeling of tiredness, you're just not feeling well. Some people complain of chest pain.
Yes, and this one is the tricky one because it can vary from, severe chest pain all the way down to just a minor chest pain. And usually women would normally present with like a feeling of like indigestion or more like what you think is a reflux symptom. So that's how a woman would present. And usually the men come in and they're like, it's a crushing chest pain. They're holding their chest, they're doing this exact motion, it's crushing, it's in the center, radiating to the left. It feels like something is on my chest, going down my arm, going up my jaw, any of these kind of symptoms. Or it could be like pins and needles, sharp chest pain. So it actually varies based on people. But what you need to know about your chest pain is that if it lasts for 20 minutes or more, you need to go to the emergency room to have it checked out. I can tell you, I've worked in the emergency room and I've had so many people come in thinking they have reflux and they're having a heart attack.
Or even some people complaining of just feeling generally unwell. There's something called a silent MI, which is a heart attack, and you have absolutely no signs or symptoms. You just generally feel a bit unwell.
And that happens mostly like in diabetics.
Right. So continuing, some of the other things that people come in and complain about is, they can have sweating. They're just feeling hot. And sometimes they can complain of heart racing or palpitations. So if you're just generally not feeling well, your heart is racing, you're having a degree of shortness of breath. This is another point. This is another symptom that some people complain about. There are patients who come in and they have increased blood pressure. Or if your blood pressure is low, then there's another reason that you might be having a heart attack. Some people complain of headaches, some people complain of dizziness. Generally, these symptoms run the gamut of just feeling unwell. So if you're at that age where you are going to have some risk factors for having a heart attack, then it's something that you should consider and come and check it out. Make sure you see a health care provider in order to determine whether you've had a heart attack or you've not had a heart attack.
Better to be safe than sorry, but it's important also, just like the signs and symptoms, that we also know exactly what are our risk factors. What makes us more predisposed to having a heart attack?
Yeah, well, some of the risk factors are modifiable and non-modifiable risk factors. The non-modifiable risk factors you can't do anything about. Those are things like age. As you get older, you have an increased risk of having a heart attack, as well as male sex. The male, unfortunately, fellas, we're more predisposed to having heart attack. And the other risk factor is family history. If you have a family history of heart attack, then you're predisposed to having a heart attack. So that's something that you need to be worried about. Now, the modifiable risk factors, now these are the things that you can change. You can actually do something to affect how you're going to have a heart attack. Now, some of the risk factors include smoking. you need to stop smoking or decrease your smoking if you can, and that is definitely a modifiable risk factor, as well as diabetes. If you are diabetic, that does increase your chance of having a heart attack. So what you do need to do is decrease your sugar intake and have your better control of your glucose. That's what you need to do. As well as if you're hypertensive, this is another risk factor that's modifiable. If you're hypertensive, then you need to take steps and optimize your blood pressure so that your BP isn't so high as to predispose you to having a
high pressure that your heart can't like pump against. So you're predisposing yourself to like heart failure, working your muscle more, making your heart get more enlarged, predisposing you to heart attacks as well.
Obesity, that's another one. And when you're obese, then you're carrying on a lot of weight, your heart has to work hard against an increased size. That puts some strain on your heart and can cause increased risk for having a heart attack. The other thing that can cause you to have a heart attack is if you have a sedentary lifestyle, you're not exercising, you're not moving around, you're not active, then that increases your risk of having a heart attack, as well as stress. Stress does play a role in having a heart attack, but something that's even more important is your diet. Diet is important because this is a modifiable risk factor that you can take steps. You can take active steps starting from now to decrease your risk of having a heart attack. You can do things like have low-fat diet. You can have food that decrease in cholesterol, decrease your cholesterol intake, increase your fiber, low salt diet. All these things you can change your diet to decrease your risk of having a heart attack.
This is why when you come to the hospital, you've had a heart attack, you're on a specific type of diet. But when we come back, we're going to hear from one of our guests sitting right here with us to go through that he had a triple bypass surgery after having a major heart attack. So stay tuned.